see what will happen. Yes, so we are live.
Okay.
Hi, good evening, everyone. It's so unfortunate that my network is a bit bad and my own screen is blank, but I'm hoping everything would get better. Yes, so let's wait a little bit for people to join in, to come in, and then we'll start. Let's see. Let's
I
wait a
need to.
while.
I want to share.
Okay, on your Facebook page.
Mm-hmm.
Okay, so what we'll do is
I guess I
okay,
need to find you.
so yeah, so you go on Facebook, then you find me, and then so one person has joined, and then let me see. Hi, welcome in. Thanks for joining,
Yeah.
Abdul. Yes, so we are live. Hi, one. Let me try and tag you.
I've seen it.
Okay, okay, okay. Okay, so yes, Ras, my camera is not off. I think my network is fluctuating, so that's why it seems my own space is blank. But yes, so we have doctor with us now, and we'll start right away because she has a meeting to attend. Yes, we are talking about you and your kidney. We are talking about you and your kidney. And we all know what the kidneys are. We have two of them. Every human being has two of them. And with the kidney, your lifestyle could affect it. You see, if you smoke a lot, you drink a lot, you take medications without the doctor's prescription, it can affect your kidney. And do you know that as men, it could even give you, I mean, have an effect on you that's erectile dysfunction. And it would be as if, you're not performing well. It could be a symptom of a kidney problem or disease. And we should also know that about 46% of the youths, when I say the youth, that's like 15 to 40 years thereabout, about 46% of them are hypertensive in Ghana, or let me say of us, you see. And for kidney diseases, we have some risk factors. And as such, you will have to be careful. But I wouldn't go into much details because Dr. Hectoria would go deep into that. So Dr. Hectoria is anyway. Okay, let her introduce herself. So let's welcome in Dr. Hectoria. And Doctor, over to you. Please introduce yourself and let's start.
Okay. Thank you, Anita. Thank you for having me. My name is Hectoria Awekeya. I'm a medical doctor by profession and a health advocate and a health blogger by choice. And I love this so much that when Anita gave me the opportunity or brought the invitation, I was so excited about it. And I'm excited to be on her page. I'm excited to also be on my own page for the youth of today. And of course, everybody who is interested in knowing more about their health and especially about their kidneys to join in this conversation. So thank you, Anita. I think that we are good to go.
Yeah, yes. So thank you, Doctor. Hey, your name Awekeya-Wuobar. Did I get it right? I don't want to pronounce that one. I know it. All
Yeah.
right. So
Let's start with that one.
yes, yes. So yeah, you had Doctor introduce herself, and we are going to start now. Now, Doctor, the kidney. We know, I know that we have infections. Some they will say that a doctor will tell you that, oh, don't panic, maybe because a medication will just solve it for you. For kidney, do we have minor infections like that?
Yes, thank you, Anita. So I will not really say minor, but we have infections that can affect your kidneys. So the common one we usually talk about is pyelonephritis. If you get a urinary tract infection and it's not treated properly or on time, or you did not complete your medications, which many of us are very, I mean, we like to do that. We are culprits in doing that. You get a urinary tract infection, they give you medication for 5 days, for 7 days. You take 3 days, the burning sensation stop, and then you stop taking the medication. Sometimes, if the infection is not dealt with properly, it will ascend or move up and then
Hmm.
affect your kidneys and give you pyelonephritis. It's an infection of the kidneys, inflammation of the kidneys. So we have something like that. This infection can be treated also correctly. I mean, if you give you good antibiotics for the right dose and then the right duration, it can be taken care of and you will not have any complication thereafter. But like other infections, when people get well, sometimes they stop taking the medication and the rest of the infection will continue to linger on in the background and will then result in chronic kidney diseases as a complication. We also have other infections that can affect other inflammatory processes. If you've heard before, you've heard something like glomerulonephritis. Okay, these are
Yes,
things that
yes.
sometimes can occur in either in children, but it's usually in children or young adults. If it's not taken care of well, you do not take your
Hmm.
medication for the length of time that you were put on it, it can also result in a long while in kidney diseases. So yes, we have acute
Okay.
infections that can result in complications if it's not taken good care of.
All right, all right, all right. Now, are there? Okay, no. Let me go to this. At what point, or let's start from the symptoms first.
Okay.
What symptoms is one, or am I likely to see for me to, or for the doctor to say that I'm very sure you are having a kidney problem? For you, the doctor, to diagnose the patient, to say that, oh, Asimesi, I think you have, even without maybe a test, I'm sure probably you have a kidney problem. What are you going to see as a doctor?
Okay, so the first thing is that sometimes we don't even see anything at all, asymptomatic. So you will
Mm,
not see any symptoms at all. And that is why we encourage when we come to the prevention and then the management, the very first thing we will talk about is regular checkups because you may
okay.
not until it is very late most of the time. Other times too, you may feel fatigue because of what the kidneys usually do.
Mm,
Maybe if time will permit, I think we need to go back and talk about the functions of the kidneys. Then you will understand because because of the work it does. If it's not doing it well because it's ill from either a chronic disease or an acute illness, then you may have the person coming in with frequent fatigue, always feeling tired and not being able to function to their maximum. Sometimes we have facial swelling. It may, most of the time, it may appear early in the morning. When you wake up, you have puffy face, and especially around your
Okay.
eyes. Then you also have swelling of your feet. Some people will
Okay.
come in with bloody urine. They urinate
Okay.
and you see, yes, streaks of blood in their urine, or
Okay.
foamy urine, which we will call frothy. So when you wee on the ground or in a pot, you see that a lot of foam
Mm-hmm.
comes. So usually foam will come around depending on how the pressure comes with it. But if you see more foam on your urine, then it may be a symptom. Or if you come to us complaining of foamy urine, it's one of the things that we'll be talking about. And we'll also look at frequent urination at night. So some people um in their normal state, maybe urinate three
Mm-hmm.
times a night because you take a lot of
Yeah.
water. That is how you've grown up. That is how it has been for you. We are not usually talking about that. But someone like me who can sleep the whole night without getting up to go to the bathroom, and then
Mm-hmm.
suddenly I start getting up twice, three times, four times, maybe six times. Some people will even come six, seven times in the night. So you are barely not
Mm-hmm.
sleeping. That is so that is something that we can be looking at the kidneys. The other thing
Okay.
is weight loss,
Mm.
and loss of appetite. So they are not able to eat because of the
Okay.
toxins that are accumulated in their body, and eventually they start losing weight. So these are the
Okay.
common symptoms that come.
Okay. Okay. So, are you trying to say that when you see the symptom, doc, please, I think you have to. Your face is not showing very well on the screen. Yes. Yeah. Great. Better now. Okay. And I think you have to shift a bit to your, I think, left.
Left.
Yes, to your, better. Yes. Yes. Thank you. And I like what you are wearing. Yes. You are repping the Ghana Medical Association. Yes, she's the focal person in Kofodia, and she's been doing wonderful work since the COVID started. And I mean, even I myself, she's my mentor. Let me put it that way, you know.
Hey,
Yeah,
Anita,
so
no woman.
doc,
Yes, Anita.
ah, so when you see the symptoms, we should just go to the hospital, right? That's just what you are saying.
Exactly. There's no need to wait. It's better to
There's no
go when, for you to be assessed, and we'll say there is nothing, rather than to just keep experiencing it for 1 month, 2 months. Some people will come with a
hmm,
history of 6 months history of having blood
hmm.
in their urine. And you
In the
ask
urine.
months, what were you doing and waiting for 6 months? So the earlier you
Hmm,
report, the better, because some of these things, if they are taken up very early, your kidneys will be salvaged.
hmm, hmm, hmm. All right, doc. So, when we talk about obesity, weight, BMI, do these things have anything to do with kidney?
Okay, so obesity or increased BMI will not necessarily be a direct link, but an
Okay.
indirect link with other complications such as hypertension. You know,
Okay, we'll come to the risk factors.
so it's not a
Okay, so
direct link, but
it's
if you
not a
have
direct.
it, yes.
Okay. Okay, so listeners, so it's not as if maybe when you are fat, let me in quotes, Oshua and non you are likely to have a kidney disease or infection. Do you get it? And non by non so um don't look after your, I mean, watch your weight. You know, you have to watch your weight, you see. So that is not a direct link. That's what doctor is trying to say. And so now, doctor, from this, then let's go to the risk factors. What are
Okay.
the risk factors?
All right. So the number one risk factor for kidney disease, or one of the topmost risk factors for kidney disease, is something that we cannot do anything about, and that is the black race. Kidney diseases are more common in we blacks, or in us blacks, than the
Oh, I see.
Caucasian. Yes.
I see.
Just being a black alone, your risk is higher than somebody who is white. The other thing is
Okay.
increasing age, and that is
Hmm.
also something we cannot really do much about. Increasing age. The older you get, the more likely you are to develop other problems, and that can bring you kidney problem. The other thing is a family history
Okay.
of hypertension, family history of diabetes, family history
Okay.
of kidney diseases. So if
Okay.
a parent or yes, a parent or a sibling has any of these conditions, then your
Mm-hmm.
risk of getting it is higher, and so your risk of
Okay.
kidney disease is also higher. And then your
Okay.
own personal risk, I mean, your personal history of hypertension, diabetes, and then
Mm-hmm.
yeah, these are the things that will increase your risk of having a kidney disease. So in effect, we are
All
not saying if
right.
you have diabetes, you will get it, but your chances of getting is higher than somebody who does not have
Who does not have
diabetes,
it?
hypertension. Yes.
Yes, and even in relation with the COVID, we can see that people who have this underlying conditions, especially the hypertension and diabetes, they tend to, let me say, suffer the severe complications of COVID than, you know, anyone that doesn't have this underlying conditions. Okay, thank
Yeah.
you, doctor.
Anita, let
So
me
from,
add, sorry, among the
okay,
risk factors that I did not mention is sickle cell
okay,
disease. Sickle
okay.
cell disease. And my sister who works at the renal center in Kolebu is telling me how sickle cell patients are coming in with complications of kidney disease, especially those who have SC. So
Mm.
SC patients do not have the classical sickle cell
Yeah,
symptoms. They
yeah,
don't have
yeah.
crisis all the time. So
Mm, mm.
we usually do not pay much attention to them. We just
Attention
say,
to
"Okay,
them.
the ST, that's it." Then we just let them go. But they are the people that come in with chronic kidney disease because much attention is not paid to them. Their use of medication, things that will keep their kidneys healthy. So sickle cell is one of the risk factors that we are turning our eyes to, and especially those who have SC. You need to seek regular care for you to, be taken good care of. The other thing is chronic use of medications, like earlier on
Mm-hmm.
Anita mentioned, and especially non-prescription drugs. Because if we prescribe medication for you, we usually, especially long-term medications, we usually would monitor your kidney and your liver from time to time. But if you continue to
Yes.
buy drugs without prescription, you put yourself at a risk of getting some of these complications. And then chronic use of herbal drugs.
Please,
When you turn on
um,
TVs,
talk
radio
more on this
stations.
herbal drugs. Now in Ghana, we see that one herbal, a bottle of herbal liquid is said to cure. Ghanaians like the waste medications. Usisi medru or what? Yeah, sisie medru. Or person sisi mu yɛ
Mm,
den. Okwabena ni sɔre
mm,
anɔpa a, he doesn't have a job. The first thing the person thinks about is how his waist will be what? Is it feb? I don't know. You see, how he's going
so
to sleep with a woman, you see, and he doesn't even have a job. You get it. So they buy these herbal medications, and the seller will tell you that it cures malaria, it cures hypertension, it cures knee, sasabro, arthritis, headache, halitosis. They will mention all. So you see, they don't even know the contraindications in this herbal concoctions, I would say, because they are not, I wouldn't say they are medications, they are concoctions, because they've not taken them to the lab to even test and, know the concentration of maybe calcium or iron or whatever that is in it. And a lot of them have the impurities, you see. So, doctor, please touch on that more.
Anita, you have touched on it. So yes, chronic
Yeah.
herbal medicines that are not approved, they are not approved. And so, I mean, you've said a lot, and it's really a bother because we've even had people coming in with acute kidney diseases because of these herbal concoctions, like Anita
Medication.
is. There is no measurement. I mean, what kind of medicine are you taking without measurement? Is that 1 cup? What is 1 cup? My cup can be
Mm,
like this. Your cup can be
mm,
like this. Another cup is like this. So medicines that are not approved, medicines that do not, herbal medicines that are not appropriately prescribed. You know, now we have
mm-hmm.
herbal centers in the hospitals where their
Yep.
medications are approved, and I mean approved by the FDA, and there is correct measurements for these medicines. But those that we buy in the market and by the wayside, in fact, they are causing a lot of problems for our young men and our young women. So these are some of the things that I wanted to mention. Yeah.
Okay, okay, okay. Now, let's go to children. Are children too at risk of kidney infections?
Yes, children are at risk of kidney infections, just like an adult. And for children, the
Okay,
commonest risk is nephrotic syndrome. So, nephrotic syndrome, maybe the child will get a sore throat or ear
okay.
infection, and then days later, you see that the child is having these puffiness around the face, swelling of the feet or the body, and then instead of the mothers to bring them to the hospital, they will tend to unapproved use of unapproved herbal medications, and then they come in
Mm-hmm.
with, I mean, the kidney and the liver totally gone. So nephrotic syndrome is very common in children, and it's very treatable. If it is picked up early, it can be treated, and the complications will not occur. So it's
Okay.
important that when children are ill, their parents take them. And the symptoms are basically the same. When the child urinates, the urine is like foam. I mean, you may see blood in their urine, and the child is puffy. Yes, so children
Hmm.
are at risk of kidney diseases as well.
Okay, so now we we are almost, because you have a meeting, so we have to round up. The complications. We've not touched on the complications, right?
Yes.
Okay, so maybe you do the complication and you can, wrap it
Okay.
up. I will take the diet, yeah.
Okay, sure. So for the complications, the commonest one is recurrent anemia. You know, the kidney, one of the function, it helps to produce red blood cells. Okay,
Yes.
it has a hormone that will stimulate the production of red blood cells. So if it is ill, either chronically or acutely, your kidneys will not, I mean, your blood level will continue
Doc,
to
please
diminish.
shift to the left. Your push, you always tilt, better. Yes.
So recurrent anemia. The other thing is the water retention, hence explaining the puffiness. Because
Okay.
if the kidney is ill, it's not able to filter and maintain the proteins and whatever that we need in our blood to keep the water level in our blood. So what will happen is you'll be losing these proteins, and then it will go along, and salt, and it will go along with water. So you see that you'll be retaining water in your blood instead of some of it being lost, because they will not be able to urinate frequently. And because of that, all these retention will happen. The other thing, some of them will come in with heart failure, some will come in with confusion depending on the stage of the complication. They'll come in with confusion. You talk, they don't understand what you are saying. Some will come in with itching body. They just itch and itch and itch. Some will even come in comatose. They'll be in coma. And of course, the eventual thing is death.
He's dead. Now, Doc, let me quickly touch on this. With the kidney, these days you see fundraisings for people with severe kidney issues. Some even need transplants. Um, just want to ask, because sometimes it's almost maybe the family members definitely know that probably the person is not going to make it, but they still go ahead soliciting for funds, borrowing funds to keep the person in hospital. Um, as a doctor, I feel for me, you are the ones in the in the clinic. For me, as a public health advocate or someone creating awareness, sometimes in my own thought, I'm not saying maybe that's right, but I feel maybe when you know that it's gotten to that condition, why not concentrate more on maybe you bring the person home, feed the person well, let the person live very well till probably death comes, because we definitely know that the outcome is death. Doc, what's your take on this? Because they borrow money, they spend money, and at the end of the day, the kidney is not, you can't treat it. So, what do you think, please?
Okay, thank you. So you see, when it comes to some of these decisions, you as a
Yeah,
doctor, you can only do as much. You can only advise. You can
yeah.
give. Yeah, you usually will provide the options, and
Mm-hmm.
it's difficult, Anita. It's difficult because losing a life, I mean, a loved one is usually very difficult. So sometimes,
Mm-hmm.
for the purposes of the family's psychology, that we tried,
Yeah.
well, we tried.
Okay.
It's not that we just gave up. When the doctor said it, we just gave up. Other times,
Mm.
to I would say that maybe the counseling or the understanding of um, the whole process, how the events are going. Sometimes I
Mm-hmm.
may also say that sometimes the family either did not understand what is going on properly, because
Mm, mm,
properly, or maybe the time we were
mm,
counseling, because they were already preoccupied, they had already decided. So no matter
mm.
how much we counsel, they will still make their
Yeah.
decision anyway. But at the end
Okay.
of the day, it's patient experience. What they want is what we are entreating the health service to give, because it will make
To
them
give.
feel better in themselves. Yes. So you just give them the options and then they
Okay.
decide.
Okay. Okay. So, Doc, what are you going to, since you have a meeting, I would continue. What are your last words? What do you want to tell people? Advice. I mean, about their kidney, how to care for the kidney, how to be
Yes.
conscious. They should be conscious. I mean, so say something to them.
Yes. So what I would say is that we need optimal treatment for patients who come in with diabetes and hypertension. If you are a diabetic and a hypertensive, we need
Mm-hmm.
you to be responsible. We need you to
Mm-hmm.
discuss your treatment plan and options with your caregiver. Know your
Mm-hmm.
targets, know the levels that you should be for optimal health, where your kidneys are
Mm-hmm.
protected from this chronic disease, because sometimes it
Mm-hmm.
saddens my heart to see that someone is on medication for diabetes or
Okay.
hypertension. The sugars are
Mm-hmm.
always high, his blood pressures are always high, and yet he's taking medication. So my point is, if you are taking medication and you are not getting the benefits, why are you taking the medication? So know your
Mm.
number, and try to understand from your doctor, what are the numbers that would give me better health, because you
Mm.
cannot be on a hypertensive treatment and your blood pressures are always reading 150, 100, 160, 100, and you are okay, and then you go for review and your doctor says go. No, you need to have a discussion
Mm.
with your doctor. Doctor, these readings, are they good? Or if the person
But
is
you
not
doctor, but
the
okay,
discussion,
finish.
you need to move to another hospital or another doctor where they'll have time to explain some of these things to you. Because I, for instance, maybe because of where I am standing right now as a health
Mm.
advocate, I don't see
Mhm.
why I should be swallowing pills and not
Mhm.
getting the benefits that I should be getting from it. You
Okay.
understand?
Yeah.
So the Ghanaian patient need to be empowered. You go to the hospital, they give you medication, you've come, they don't understand why they are taking the medication. They don't know they are taking diabetes treatment. You ask them, so
Mm.
what are your targets? They don't know their
Mm.
targets. It's wrong. It's wrong. We need to begin to have some of these conversations. The other thing
Mm.
is, what is within your reach? So weight, obesity, high salt intake, not drinking
Mm.
adequate water. These are simple things that if we don't do, we harm our kidneys. Salt.
Mm.
We don't like too much salt. And I have even written an article on salt. It's too much
On the site.
where, yes, on my blog.
Okay,
Salt,
I'll put the link there.
the salt is too much. We need to work on reducing our salt intake, and especially for our children. Especially for our children, because they are now developing their taste buds. And the best gift we
Mm.
can give to our children is to introduce them to low salt diet and low sugar diet, so that their
Mm.
taste buds not follow ours that love so much salt. We have to let our
Wow.
children begin to make better options for themselves by leading the way for our children, because they are only children. They will go the path that we chart for them. The other thing I also want us to talk about is continue to have such discussions,
Yeah.
advocacy. There is never too much advocacy. Let's continue to talk until the last person gets the message that drink adequate water, and especially on
Okay.
sunny days, drink more than 2 liters of water if it is very hot, or at least, somebody can go the whole day, Anita, and has drank
Mm-hmm.
only one sachet of water. That's
Of water.
500.
Yeah.
You are harming
Meals.
your kidneys. You are harming your
Yeah.
kidneys. Try to drink. Let the kidneys flush out the toxins. At least
Yeah.
4 sachets of water. If you don't drink at all, at least on a sunny day, 4 sachets of water.
Yeah.
Don't wait to be thirsty before you drink. That's what I always tell my patients. If you wait to be
Mm.
thirsty because of our environment, sometimes you will not feel thirsty, but just sip,
Yes.
sipping and keep sipping. And before you realize, your 2 liters are done. And of
For the
course,
day are done. Yeah.
I cannot continue. I cannot stop talking about salt. The salt is too
Mm.
much. Let's work on it.
Tolo beef
And Kobe.
and Kobe.
Yes, yes, yes.
Yeah, so all right. So Dr. Awekeya-Wuobar, thank you very much. You have a meeting, so you can leave the studio whilst I continue. Thank you very much for
Thank
giving
you
me
very
this,
much, Anita, for
opportunity
having
and
me.
joining me, because you are so busy. I know how it is for you.
Thank you
So
for having
all
me.
right. So thank you. All
Thank you.
right.
Have
So you
a good
can go.
evening.
Yes, you
Hi
can
to
leave the
your
studio.
audience.
Yes. All right. So Dr. Hectoria has a meeting, emergency meeting now, and in the hospital, and she has to leave. Yeah. So we continue from here. Yeah, and just like Doctor was saying, I'll just touch on some of the points. You see, nutrition, your water intake. As a man, as a woman, at least for a man, at least 3.5 liters of water, and for a woman 2.5, and that should be like about 4 sachets of pure water, or five, yeah, if I'm right. And then the kind of water you drink. You see, some of us, the quality of water we drink is not good. And that in effect, affects the kidney. You see, maybe like your extended family members in the villages, in the rural communities, you see that like the effect of galamsey, some of them drink directly from these sources of water, the rivers, and now all those rivers are polluted. So there are traces of harmful toxins in the water that they take in. You see, so you'd be wondering why someone who lives in a rural community would end up having a kidney disease when the person doesn't live in the city. You see, so the water, the quality of water intake matters. Now, exercise. It's not necessarily like maybe you go to the stadium, or maybe you go to the gym if you don't have money for, gymming, or getting a personal trainer. But exercise, walk around, aya nante nante. cobra, uti baby baku, like in the office, you are static in one point. No, stand up, walk around. If you So sorry, my network went off a bit. So instead of you going, when you're going somewhere that's not too far away, take a walk instead of using your car or probably picking an Uber. You see, so let's exercise and then wait. Now, doctor said that you having a higher BMI doesn't also mean that you are going to have a kidney disease or infection. No, but then it is a risk factor. You being obese or being overweight, I mean, it makes you at risk of having diabetes, hypertension, and these two are the what should I say, recipe for kidney disease. These two things, hypertension and diabetes, yeah, they are the risk side for disaster for kidney disease. And then kidney function test. You have to always go for a checkup. Most of us don't go for checkups. Well, because you would say that maybe you don't have money, but then treatment itself is expensive. So try the preventive way. You go for checkup as a when needed, and then you eat well. You eat more greens. Drop the fats, the baked things, and you will be fine. And another thing I would want to mention is intermittent fasting. Now, it's not the like every day you fast, but sometimes you need to stay away from food and take in more fluid, so that the system would even relax a bit. You see, so it's not every time or every day you have to eat like some of you eat 5 times a day, which is not healthy for you, and unnecessary snacking. Eat full meals instead of you eat a little here, you go and buy a cake, you go and buy this, you go and buy that. Then the fizzy drinks, you have to do away with them. Alcohol, you should reduce the intake of alcohol, especially when you are grown. And even if you are still young, you have to take the preventive means. So you reduce the, intake of alcohol. Too much of everything is definitely obviously bad. We all know this. Then the last thing is self medication. A lot of us now with the COVID, a lot of us self medicate on vitamins, calcium. What is it called? Uh, some even take folic acid. Some take vitamin E. Fine, they are over the counter drugs. But if you're not really, if you eat well, you can still get these things from good food that you eat. So you probably don't even need them. But then we take all these things and you're harming your kidney in the process. Paracetamol. Let me emphasize on this. Those of you that take paracetamol, analgesics without prescription, any little thing, you just pop some paracetamol into your mouth. It is very, very risky. Very, very, very risky. And it could give you, lead to a kidney disease or malfunction. Now, the enhancement pills, beauty enhancement pills for the women. Now, the women, it's not only the cream or maybe the soap they use on the face and to bath and to bleach or to tone. Now, some take the tablet. You are harming your kidney and liver. So there are some things you should just stay away from. You should stay away from them. Then steroids. Some of the men too, they take these things for enhanced performance in bed and all that. Who are you trying to satisfy? Because usually normal sex shouldn't even exceed like 10, 5, 6 minutes. So when you take all these things in order to say maybe ubepra obano, you see, it doesn't make any sense. You are worrying your system or you are disturbing your system. And then the last thing, okay, doctor touched on the blood pressure and the diabetes. So always, if you know that in your family the hypertension and diabetes runs in your family, always make it a point to always go and check for your sugar level and then check your BP so that you wouldn't probably we may not even need medication. Always checking, would make you know the point at which you are. And then there's one other thing point I wrote I wanted to touch on. Um, let's see. Now, even with the supplements we take, it's the kidneys that absorb this supplements. So if your kidneys are not even working well, you would see that they wouldn't even be able to absorb this supplements that we take every day. Well, so we are going to end here, and I think the take home lesson is for you to exercise a lot, do some walkings around the house, change your diet, change your lifestyle, go the preventive way. You see, drink good water, drink a lot of water, more water, more water, more water, and reduce the portions of food you eat, and then try to check your weight so that you wouldn't be overweight, and as such you'll be at risk of having a kidney infection or disease. So thanks to everyone who joined. Bell, Russ, I can't see some people. Let me check on here. Thank you all for joining, and we will be having another episode very soon. This is just about awareness, just creating awareness for us, and then yeah. So I think I can see Nene joined. Thank you. Felix joined in. Thank you. Kwamina joined in. Thank you. Then a lot of thanks to Raz for the poster you did for me yesterday. Thanks a lot. And then who else? Okay, I think a whole lot of other people joined. Thanks, 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 thanks. So I'm going to sign up. But then before I go, I think as women we have to be careful now with this kidnappings and missing people around. When you are going out as a woman or as a lady, let other people know where you are going or your whereabouts. And I think for now, ladies should stop meeting unknown people, in locations that are hidden. If you are to meet anyone, you do that in the open because the number of missing women is increasing now. And then let's stay safe and, stay healthy. Thank you. Bye bye.